Account Executive, Jessica Warner. Hi, Jessica.
Hey, Bart. Thanks for having me.
Yeah, good to see you. Welcome back.
Yes.
It's Medicare open enrollment season, right?
It is. It is. It's that time of year again. So each year from October 1st through December 7th, individuals that are enrolled in Medicare Advantage plans have the opportunity to change those options, as well as your standalone prescription drug plans, so they can switch to something else. A lot of changes this year, so definitely recommend sitting down, talking to somebody about that. And all those changes that are coming to fruition this year.
All right, well, we sat down, Jessica and my family sat down a few years ago, and you really educated us. It's a lot.
It is.
So who's Medicare for?
So Medicare is for individuals that are 65 and older, or if you are Medicare disabled, so you could be under 65 and still be eligible for Medicare A and B. But those are usually special circumstances, and you have to meet a certain criteria for that. But typically it's those individuals that are over 65.
So somebody that made their decisions and everything last year, do they have to do it again this year?
So they don't have to. If they want to stay in the plan that they're enrolled in, as long as that carrier specifically that they're enrolled in has not gotten rid of their plan, they could just continue as is. There's a lot of different carrier options out there. There's a lot of different products out there, and whether that's Medicare Supplement or Medigap, those terms are used interchangeably, or Medicare Advantage or Medicare Part C, those terms are used interchangeably, just to add lots of extra confusion. It just depends on what they're enrolled in, but typically if the carrier is not getting rid of their plan, they can just renew as is, keep paying the premium, or if it's a zero premium plan, just stay as is, and it will renew with new deductibles or copays and out-of-pocket maximums effective January 1st.
And trust me, those insurance companies are going to send you a ton of mail after you've enrolled, and you you'll know, right?
Yes, yeah. Absolutely. And actually, as through CMS, which is the Center of Medicare Services, every carrier is required to send enrollees what's called an ANOC or ANOC, Annual Notice of Change. So if a member's enrolled in a Medicare Advantage plan or a standalone prescription drug plan, and that plan has changes, that has to go out to the members. Now, with this year being a very big political year, in addition, a lot of those sometimes get tossed by mistake because everybody gets so much mail at this time of year. So I always recommend keep an eye out for that. If not, you can always reach out to whoever you wrote your Medicare product with and go over just those changes again with them.
All right, you mentioned Medicare Advantage is the same as Medicare Part C?
Correct.
So what does that mean? What are supplements? What's Medicare Advantage? What are the differences?
Yeah, so original Medicare is the Medicare Part A and B, and that's what goes through Social Security. So A is your hospitalization, B is your physician services, doctor visits, and then you have something that would pick up what original Medicare doesn't cover. And so a lot of times you have the products of a Medicare supplement, which works as, I guess I'll use the term Medigap just to make it a little bit more simple, but it fills in the gaps that original Medicare doesn't cover. So the deductible, the co-insurance, daily hospitalization, co-payments, but it's strictly a medical product. So if you elect a Medicare supplement plan, you have to have a standalone prescription plan, which is called Part D, as in dog. So again, another alphabet letter to throw out to you. With the Medicare Advantage plan, those are more tied to a specific carrier network, first of all, but it reworks the way original Medicare works. So they're going to have co-payments when you receive care at your doctor or if you have rehab services. But those are also nice products because they throw in additional bells and whistles, such as dental, vision coverage automatically included, Silver Sneaker fitness program through a local gym or YMCA is included, and then that prescription is already tied into it. So for simplicity purposes, some people elect to have those type of benefits instead of a supplement, but I can't say there's one right way for everyone. It's just depends on your case and your circumstances.
Everybody's different.
Everybody's different, yes.
All right, so you mentioned changes, a lot of changes this year. What about with the prescription plans, what's new?
Yeah, so the biggest change with Medicare this year is, and this will affect standalone prescription plans and Medicare Advantage, is that the donut hole has gone away.
The donut hole has gone away.
Yes, yes. And that, I think, is going to be a very good thing for a lot of Medicare recipients because, as we all know, drug costs are usually a huge factor for all Medicare individuals, especially as we tend to get older. But it used to be you had to get to an $8,000 troop, as it was called, or true out-of-pocket maximum on only prescriptions before you hit the catastrophic phase. Starting in 2025, that has been reduced to $2,000. So the calculation into what goes into that $2,000, because each drug plan may have, I shouldn't say every, you may have two different categories, whether it's a standard drug formulary or an enhanced drug formulary. So carriers may have a difference there, but again, if you're on a lot of prescription drugs and you were hitting that 8,000 troop in the past, it definitely makes sense to sit down and review those because you may have a better cost option this year.
And you're the person to sit down with.
Absolutely, absolutely.
All right, if somebody would like to talk to you about this, they just give you a call?
Yep, just call the Craft Agency and ask for me specifically, and we can sit down, set up an appointment. I like to do those meetings in person because, as you can see, it's a lot to go over.
We sat down with Jessica a few years ago, and yeah, it's you really need to as you arrive at that age of 65.
Yeah, yeah.
Thanks for coming in.
Thank you for having me.
From the Craft Agency, Benefit Specialist and Commercial Account Executive, Jessica Warner.